Thank you, Jody. Good evening, everyone. My name is John O'Grady. I am the president of the Board of Franklin County Commissioners. Welcome to our next segment of Commissioners' Conversation on COVID-19. We started these conversations online a few weeks back. The topic of the conversation has been the coronavirus crisis. We've been trying to center all these conversations around the safety tips and other useful information during the crisis. This crisis and the virus spreads very, very quickly. Our first case of coronavirus was detected in Ohio on March 9th. And as of today, we have 17,303 cases in Ohio with 937 deaths in the state of Ohio. In Franklin County, as of today, we have 2,216 cases. And so things are moving very rapidly here in central Ohio. We have more than well over 60 deaths in Franklin County now. I don't know the exact number, but it's over 60. Unemployment continues to rise. And so this is going to be essential workers and employment are going to be the topic of tonight's conversation. Unemployment continues to rise. Here in Ohio, we have had in the first several weeks of the first 4 weeks of the crisis, we had more folks file unemployment claims in those first 4 weeks than in all of 2018 and 2019 combined. So today my guests are Dorsey Hager. Dorsey is, you'll give a little wave there, Dorsey. Dorsey is the Executive Secretary and Treasurer of the Central Ohio Building and Construction Trades Council. Steve Stein is with us tonight. He is the President of the International Association of Firefighters Local 67. I have to be good to Steve because many of his members went to my high school. So I always got to be good to him. And also Mark Fluharty, the Executive Director of the Central Ohio Labor Council, AFL-CIO. Mark is also originally out of the United Food and Commercial Workers, and he's an old meat cutter from Meyer back in the day. And so we're going to talk to him, especially tonight, about essential workers from the grocery store workers, but also other members of his that he's responsible for as well, not just grocery workers, but we do all appreciate the grocery workers in particular at this time. So these men all represent union members from several industries, including many essential employees who are putting themselves in harm's way right now to help us all get through this. And so while I in particular am always very, very appreciative of our men and women in the labor movement, I am particularly, and we all should be particularly impressed with them and in awe of them and thankful of them now. I also want to start by saying two things. One, if you are watching us now on Facebook Live, please feel free to, whether you're watching on the Commissioner's webpage or on my webpage or on any of these gentlemen's web pages or Facebook pages, go ahead and shoot questions to us. We have folks monitoring those Facebook pages. You can go ahead and send us questions, and we'll try to do our best to answer them throughout the course of the next hour. Speaking of that, Cheryl Munson's on, and she says hi to everybody. So hello, Cheryl. Thanks for being on. Guys, thanks for being on with us tonight. I want to start by each of you guys telling the folks that are watching us who you are, what organizations you represent, even though I just described it, go into a little bit more detail about your organizations, how big your organizations are, the size of your organizations, and then include whether your employees were deemed essential at the beginning, whether they've been furloughed, some of the occupations that you represent. Obviously, the firefighters have all continued to work, but just make sure, because not everybody's, it's not evident to everybody exactly who each of you represents. Let's start with Dorsey. Dorsey, you got to unmute. There you go.
Yep. So that's the first time. That's first time somebody's told me I've had to do that, huh? So my name's
Nobody's
Dorsey
ever-
Hager. I'm the Executive Secretary Treasurer of the Columbus Central Ohio Building Construction Trades Council. So I'm privileged to represent 18 building trades unions here in Columbus and Central Ohio. We have about 18,000 members. As you guys know, the stay-at-home order or shelter-at-home order that the governor passed exempted construction workers, deemed us to be essential. So critical part of the infrastructure going on right here: roads, bridges, highways, also the data centers, a lot of the work that's going on here in Columbus and Central Ohio that's driving the economy. So a lot of our members have been working throughout this, trying to take care of their families at the same time. So we've considered ourselves fortunate. You were talking at the beginning about the high unemployment, not only across the nation and the state, but also here in Central Ohio, as this has economically affected a lot of people that we know and even some family members. My members have been very fortunate. They've had the opportunity to keep on working.
All right. How about Steve? Steve, let's talk about the firefighters.
Sure. Thanks, Commissioner. I'm privileged to represent the Columbus Firefighters Union, Local 67. We represent 1,606 uniformed firefighters that represent Columbus Division of Fire. We're the largest fire department in the state. A lot of people don't realize we're actually twice the size of Cincinnati and Cleveland fire departments. And so, very early on, when this went from a point of concern in the media to we realized we had a pandemic on our hands, it became very quickly evident that not only were we going to need every single one of our 1,606 firefighters, we had to get them to work. And it was essential that we got them there. And that provided a litany of other challenges when things like daycare were, just became unavailable for the public at large. And so we had to kind of the opposite problem of so many other organizations and businesses and industries, in that while the rest of the world was trying to figure out how to work at home, we had to figure out a way to get as many of our people as possible to work every single day.
Great. Mark, how about you? You're on mute still, Mark. Mark, you're still muted.
How's that?
There you go. Thank you.
All right. First of all, let me apologize if there's any taxidermy in the background. Don't want to offend anybody. But I am Mark Fluharty, the Executive Director of the Central Ohio Labor Council, and we represent about 55,000 members and throughout Central Ohio, anywhere from public employees to retail to manufacturing and food processing. Most of our workers actually have been deemed essential. As we all know, we can still go to the grocery store or the pharmacy, and also food processing for the people that have to ship it and, get it on the shelf. Also, we have members in the health department who are out on the front lines every day, as well as nurses at OSU Hospital. So, yeah, most of our members have been deemed essential. I think their biggest challenge has been, getting the proper PPE to try to help keep them safe. Everybody's worried about their safety right now. And that's, a big concern with those that, are still out there working, let alone those that are getting ready to go back to work.
All right, that's great, guys. Joe Mazzola, the Franklin County Public Health Director, Public Health Commissioner, is on listening. He told me this morning he was going to be on. He thanks all of you for all the help and cooperation that you guys have been, and he says thank you to all essential workers throughout Central Ohio, and especially healthcare workers, first responders, everybody. Joe's been fantastic, by the way, through all of this. He's been a great partner for the county commissioners, does a great job for all of us. But he contacted me last week and said, how do I reach out to folks in organized labor? I really want to work with them. I really want to be in contact with all of them. And so it's great to have him on tonight, paying attention. And he's giving you guys a big thumbs up to all of your folks. So thank you, Joe, for being a part of tonight. We appreciate it. Can you guys describe some of the various issues that your essential employees are facing. For example, 6 weeks ago, PPE, protective personal equipment, was very limited outside of healthcare. No one was recommending the use of face masks at the time. Essential employees have had to learn on the fly, so to speak, how to adjust to that. Now there seems to be more. I know here we in county government have been able to get PPE for our folks. I think it's important to share a bit about this. I know, Mark, you had me on the phone today with Rick Lucas from the Ohio Nurses Association, dealing with the folks up at Ohio State. So if you guys could talk a little bit about this and about some of the changes that we've gone through and expect any additional changes that are coming. All of your folks are dealing with this. So anybody want to jump in and take it first, go ahead. But I'd love to hear from you guys. You know, what are your folks dealing with out there? Go ahead, Mark.
Myself here. Can you hear me?
Yeah.
Okay. Yeah, John, when we first started, the big, issue for everybody on the front lines was PPE. If you go out into a retail store, you'll now see, at a Kroger store, everybody mandatory to wear a mask. But fortunately, those masks don't have to be, like the N95 mask that everybody else's needs. But I know still, like up at OSU, they're still having issues with getting PPE. So that's, still a big concern.
Gotcha. Steve, Dorsey, either one of you?
Yeah, so I can just touch on, one of the issues we faced was specifically with gowns early on. And, it really, as everybody was scrambling for these different types of protection, kind of at the same time, there really became a zero-sum game between agencies trying to acquire this PPE, because everybody's trying to take care of their people, which made total sense. But I think it points to the fundamental flaws in some of the federal components of this response. That being said, we've been very fortunate here in Columbus in that we had some very serious planning early on, and our command staff, the safety director's office, the mayor's office, everybody really got on this quickly. One of the other things too that really worked kind of in our favor was after H1N1, we actually spec'd out the use of what we call a P100 mask, which is actually just kind of a step up from the N95 in that it's reusable with reusable cartridges. That was a game changer for us here in Columbus because we were able to keep our people protected and also at the same time to maintain that stockpile that we needed for run after run. We handle about anywhere between 500 and 600 calls for service a day in the city of Columbus. And so having the ability to have that reusable respiratory protection was something that set us ahead of the curve in a lot of respects from a lot of other fire departments. And, I think that goes back to the importance of those relationships at the local level and, investing in your public safety infrastructure early on. We got to the point with some of our other stockpiles where we got a lot lower than we would ever like to see. But we've been very fortunate in that we have not run out of anything. And, we're feeling pretty good about where everything's at right now as it stands today. So, challenges like everybody else has faced, but we've been able to navigate them together collectively and collaboratively.
Dorsey?
I think the biggest thing for the members of the building trades, the men and women that go out every day and, put a hard hat on, strap their work boots on, hasn't been so much the PPE, because obviously we work a lot with hazards in the construction industry. And, some jobs are hot, some jobs are cold. A lot of the jobs are dirty. But the biggest thing that our members have been working on, and our agents, our reps, our managers and our organizers to help our membership, is to make sure that the job sites that they're on are not only safe, but that they're sanitary and clean. So we've been making sure to do outreach to not only customers and end users, but also general contractors, construction managers and developers to make sure that's the case. Now, what Steve was talking about, what Mark was talking about, the PPE, I think we've kind of ran into a little bit of that with wash stations, stuff like that. And I think that a lot of the general contractors and construction managers are starting to see that, and they're starting to get some of that in the supply chain. But I think that that was the issue at first. But I think that not 100% or not totally, but a big part of it has been taken care of, which is good.
What I hear more, Dorsey, what I hear more from guys as I talk to a lot of your leaders from the different trades is, you know, some of the trades it's easier to have that 3 to 6 foot distance. Some of them it's more difficult depending on what, you know, which trade I'm talking to. And so they've been working through those issues from the get-go. It seems like everybody's having a, you know, initially when this first all started a month and a half ago, folks were initially dealing with some issues, but folks have worked through it. I've talked to all of them. Obviously, we have a couple of major construction projects going on ourselves, and so I've talked to all of them, each of the trades over the last several weeks, and they've all seemingly worked through it. And childcare was also a big issue at the beginning. That's right when spring break was hitting, and the governor, you know, extended the spring break basically, and kids were out of school much longer than, you know, so there were a lot of different issues there as well. You're muted, Dorsey. Dorsey, you're muted.
Sorry about that. Yeah, childcare was a big issue at the beginning. I think Steve touched on it very well. You know, we have spouses that have had issues with childcare where maybe, you know, their spouse was a nurse or a firefighter or an essential employee and had to go to work. So they were, you know, forced to furlough to be able to stay home and take care of the kids. We've also had some issues where members take care of maybe an elderly person in their house, a parent or a grandparent. So they wanted to limit exposure to them as well. So they've had to stay at home. And I think a lot of our managers and agents and reps have done a wonderful job of not only addressing the safety and health concerns of their membership, but also doing outreach to the membership and doing wellness checks to make sure that people are doing okay and they're getting the supplies and stuff that they need at home to be able to take care of themselves and their family members. So that's been a good thing as well.
Great. Well, that's, you know, that's definitely. So for furloughed workers, they have a different set of concerns. Can you tell us about some of the struggles that they've faced so far? You know, family also is curious if those furloughed have received an unemployment check yet. Mark?
Yeah, John, I think you just hit the nail on the head on the biggest question of furloughed workers. I do set in on a statewide conference call with the Ohio AFL-CIO, and that's been resounding throughout the state, which is with the outcry of all of new people signing up, it's overwhelmed our system. The system wasn't, you know, ready for it, and that's really nobody's fault. It's just the way it was. But getting on, logging in, and getting unemployment was very difficult. Some people have got checks. Some people have got, you know, even their federal stimulus unemployment check. But there are still people waiting for checks and still people, you know, trying to get signed up. I'd listen to the lieutenant governor every day. You know, this is a priority that we're working on. They have made strides. Don't get me wrong, but it's still an issue. And for anyone listening, if you're going to apply for unemployment, or, you know, you need somebody or know somebody that's going to apply for unemployment, try to sign up during non-peak hours. That's the best way to do it. And it's usually the most successful and less frustrating.
Great. Dorsey, Steve. I don't think, Steve, this isn't a huge issue for you, is it?
No, you know, I mean, we've been very fortunate, you know, here in the city of Columbus, with the, you know, support that we have, and really just the manner in which, you know, our response is set up. We're, you know, fire-based EMS, so, you know, just to manage this response, and with the call volume that's placed on our firefighters, you know, that's something where it was really like I said earlier, it was all hands on deck. It's kind of been the challenge we've had. So, I think it's one thing I would point out on this, and that, it's not lost on any of our members that a lot of people are struggling and suffering right now. And one of the things that, our charitable foundation has been doing has been really ramping up our support for the Mid-Ohio Food Bank and the Mid-Ohio Food Consortium, and really trying to do whatever we can, not only with nonprofits to help out in the community as well, but also working with our union brothers and sisters to make sure that we're taking care of each other and we have each other's backs, because that's really, one of the founding principles of labor and the labor movement. And so we're trying to do our part to pay it forward as well.
So before I go to Dorsey real quick, Mark, you mentioned to try not to do it during peak hours. What are the peak hours,
Yeah, your typical 9 to 5. So what I've been hearing mostly, John, is later in the evening, like 9, 10 p.m.
I got you. Okay.
Yeah.
Dorsey?
Yeah, the biggest thing that we heard was members having to wait a long time to get their first unemployment check, which obviously, if you've got, if you've got bills to pay, if you've got food and stuff, things like that to get for family members or yourself, that makes it tough. So we've heard of that. I think the unemployment checks are starting to come in now. I have not heard yet about the federal, the $600 from the CARE Act, if that's kicked in, if any of our members have received that. But yeah, the unemployment thing is a big issue. And like Steve said, we're all just trying to help each other out through this troubling time. That's the benefit of organized labor, everybody working together to pull everybody up. So that's one of the things that we're trying to do as well.
So, we at the county, the commissioners passed, it's been about a month ago now, we passed a resolution where we, working with the Workforce Development Board, we created a $500,000 grant so that out of work employees could receive some workforce development training. And, you go online, you do some workforce development training. It takes a week or two. You continue to do this training over that period of time. And when it's finished, in cooperation with the Workforce Development Board, and our staff, by the way, my staff is going to post on Facebook Live while we're talking about this. But they receive a $250 stipend. $250 in today's world is not a huge amount of money, but it's, when you're unemployed or you're on furlough at this period of time, it's an extra $250 that'll help pay some bills. It'll help buy some groceries. It'll help out a little bit. And all it takes is a little bit of time for you to sit in front of a computer screen and do a little workforce development training, which is all stuff that's going to help you out in the long run anyway. So it's something that we passed about a month ago. We put $500,000 into it because we knew that at the time there were going to be a lot of people that were going to be unemployed coming up. And so, if you want to remind your members that if you have folks that are furloughed or they're unemployed, they can go to commissioners. What is it? I'll find the website while we're talking about it. But you can remind your folks to go to this website and they can find it's commissioners.franklincounty.ohio.gov and they will find information on how to do that. Take them a little bit of time, not much, and they can end up with an extra $250 in their pocket. So not a bad thing, not a bad thing at all. So this virus has given us all reason for some concern, but what we want to know, what about your members' needs and concerns right now? So here again, I'm asking about the essential employees and the furloughed employees. So Mark, you had mentioned that there's continued to be a concern for PPE in the months to come. Are there going to be, are we going to have to, continue to worry about, for instance, obviously we're going to have to always going to have to continue to worry about PPE, but, think beyond that a little bit. Are we going to have to continue to worry about our food banks having enough food? Or are we going to have to worry about, because, you guys are in organized labor. Nobody does no organization that I know of do. I mean, there's folks in the corporate world that get involved in all these things, but no organization that I know of does more charitable works than organized labor. So I know you guys know these things and understand these things as well as anybody else. Are we, thinking about the food bank, thinking about all the different organizations out there that we as county commission, fund on a regular basis? Where are we going to have to continue to be concerned going forward beyond things like PPE? Mark, you want to go ahead?
And John, I really thank you for bringing that up. Earlier today, I was on a national call with labor leaders throughout the country on what everybody was doing in different communities to help feed people in the need. And I was very proud to be able to say how great of an infrastructure that we have here in Central Ohio with the Mid-Ohio Food Bank and partners like St. Stephen's. But absolutely, John, that going forward, I think food should be on everybody's mind. I'll make a plug here for the letter carrier food drive that happens every year. Unfortunately, that's either going to get canceled or postponed, but our local letter carriers are going to do it virtually. So there's going to be information coming out to the community how you can go online and donate on May the 9th to the Mid-Ohio Food Bank. That's going to be very important going forward. I think another big thing, John, on everybody's mind is this tsunami just below the surface, which is right now there's a moratorium on evictions, rent, mortgages, utilities. Those bills are continuing to pile up, and people are starting to get worried about when those come due, what's going to happen. Food shortage and financial assistance for the future. Another thing that I'll segue into just quickly is the concern from our brothers and sisters in city and county government. As funds start to dry up and then furloughs, start happening there. What's the future there? So those are all the three really big issues that I deal with really on a daily basis.
Gotcha. Steve, Dorsey. And as you guys are thinking about this and getting ready to jump in, let me remind our viewers out there, send your questions to Facebook Live. We've still got, some time going here, so don't forget to jump on it. We still got a half an hour to go, so we're more than happy to answer your questions. But Steve, Dorsey, do either one of you guys have anything you want to go ahead, Steve?
Yeah, I would just say, kind of quickly, and I think it's a little bit different in that, like I said, we're in this kind of all hands on deck approach with our response for our members. I know early on and really weeks into this, the biggest concern that our people had wasn't so much, specifically a patient or, a run where they were, exposing themselves to this virus. It was really, I don't want to take this home to my family. And, we had a lot of instances pretty early on where, again, not to pick on the federal government, but you look at that response and the importance of a unified response. We had members waiting 8, 10, 12 days for testing, and they're sitting there wondering whether or not that they've infected their family, whether or not they've brought this home and they've gotten their kids sick. And so, really that highlighted some real challenges, I think, for our membership in terms of figuring out, it's one thing to expose yourself to an elevated level of risk at work. And that's a reality of our profession and our job. But it's a totally different conversation and a different ballgame when you're talking about bringing that home to your spouse, bringing that home to your kids or somebody else in your family that you're taking care of. And so, with that, we had to really get creative early on in terms of alternative housing for any of our members that may be in quarantine or isolation, and giving them opportunities to, ride this out without having to worry about putting their family at additional risk. So, that's been a much more real-time risk that we've been working on and trying to mitigate fortunately, with our our partnerships here at the local and regional levels, with the city, the county, and I'd really highlight, call out Ohio State for doing a phenomenal job in making sure our people are getting tested and we're getting quick turnaround times on those test results, because that really helped us enhance our continuity of response. But I would say, in a nutshell, it was probably one of our principal concerns for our members was keeping their families safe as well, because unlike a house fire, this is something that you can bring home to your family, and that was a very real concern throughout much of this response.
Gotcha. So one of the things, so a couple things. One, there's this, and I want to get into something else here for a second, but there's this big debate over wear a mask, don't wear a mask. Wearing a mask is about, a lot of people look at it and say wearing a mask is a defensive thing. I'm wearing a mask because I don't want to breathe something in. To me, for maybe Steve, for your folks, or if you're working as a nurse in a hospital, for a lot of your folks, a mask is a defensive thing. Nurses are trying, and doctors are trying not to get sick from the patients that they are caring for. Firefighters, EMS folks they're wearing a mask, trying not to get sick from the folks that they are caring for. On a daily basis, going to the grocery store, wearing a mask is me saying, I'm trying, if I've got a cough, if I've got a sneeze, if I've got a sniffle, I'm trying to make sure that the folks that are in, and I'm not going to the grocery store, by the way, because I'm a heart patient and I shouldn't be going out of the house almost ever. But when I leave the house, I'm leaving the house with a mask on because I want to make sure that the folks that I'm coming into contact with know that I'm not trying to get them sick. And that's what wearing them, for the vast majority of the public, that's what wearing a mask is about me, or is about you saying to everyone else, I don't want to get you sick. Your people, the vast majority of your people that you represent, wearing a mask is about their safety and their health. But the public policy design around everyone else wearing a mask, the vast majority of everyone else wearing a mask, is about saying to other folks, I don't want to get you sick. Does that mean, is that something that comes up in your guys' conversations that you guys talk about?
Well, I would say, yeah, I think you raised an excellent point. And really, it's commonly understood on the fire department and, amongst all of our EMTs and paramedics, that PPE, your personal protective equipment, that's a two-way street. And so on one hand, a 25-year-old, a 30-year-old, a 35-year-old firefighter paramedic is, obviously going to be, at risk of being exposed to COVID-19. However, it's critically important we're always wearing that PPE such that when we're taking care of that 95, 100-year-old patient who has significant respiratory symptoms or significant cardiac symptoms or is immunocompromised in some other capacity, because it also, not only does it protect us from the patient, but it also protects the patient from us. This virus is unlike any pandemic that we have seen in any of our lifetimes. And by no means like calling you or Mr. Fluharty or Dorsey older than me, but I mean the reality is this is not something that has since been seen since before the 1920s, and so the manner in which we deal with this we have to appreciate the gravity of this. I think one thing I will say without going too much further off on this tangent is when you look at the numbers that are being reported, and anytime you hear people say, well, they're just not that high, that's because everybody's stepping up and doing their job, and we need to keep doing that if we want to see those numbers, because we'll listen to the radio traffic from FDNY and what they were dealing with a couple weeks ago. That's not something we want here, and to your point, it requires everybody stepping up and doing their part in wearing a mask and wearing the appropriate PPE. And that is it really is a team effort, and it requires everybody in the community to step up. And really, when you do that, even if you're a little uncomfortable wearing a mask, you're helping Columbus firefighters, you're helping Columbus police officers, you're helping Columbus public health workers do their job. You're supporting our mission by doing your part. And it might not seem like it, but it really is a big, big deal. So yeah, I couldn't agree with you more on that point.
Gentlemen, Dorsey, Mark, either one of you?
Yeah, I agree. I agree with Steve, John. The guidance and what we've had from our medical professionals has been, a mask is just as much as to protect the public from yourself as it is to protect you. And Steve's absolutely right. Go out to a grocery store, right? You'll see the grocery store clerk wearing a mask. Hopefully you'll do the same thing and give them the same courtesy, because you're helping protect. And, when you think about the statistic come out yesterday that we've now lost more people in 6 weeks of the pandemic than we did 20 years of the Vietnam War. It's real time. I mean, this is happening. And, we got to continue to stay vigilant, and keep the curve flattened for sure.
Absolutely. Dorsey?
I think Mark hit the nail on the head. I think the mask and the gloves is just being a good person in the community and being respectful of the people that are going to work every day to do their jobs, so that we can take food home to our families and we can take those essentials home. I know Mark, in his former job as UFCW, represented a lot of people into the Kroger stores, and you go into these pharmacies and stuff, and you see a lot of those people that are out there working 10, 12, 14-hour shifts, not only doing the stocking at night, but also getting the goods and stuff that we need during the day. And you see them wearing the proper PPE, and you just want to return that favor to them. Because I think, like we say in construction, and like I know Steve and his guys say too, when you start a shift, you want to go home to your family every day. And this is totally different. This is something that you could take home to your family, even if you do come home safe. And I don't think that's anything that anybody wants to do. So yeah, just out of respect, I think you should obviously do that.
Great. All right, I got a couple things here from Facebook Live, and then I have another question I want to throw in myself. So Samantha from Facebook Live says, this is a comment. She says, we need another CARES Act passed with funding for state and local government, as well as more aid for unemployed working people. Hear, Samantha. I absolutely agree with that. I think we can all agree with that. That's a good thumbs up there, Steve. I agree with you. Glenn Skeen says he'd like to ask the commissioners how he's supposed to lose the weight that he's putting on during the lockdown. My wife gave the comment. She says you need to go to the parks. So we've been getting out, get outside, Glenn. I made one of my community calls. I've been trying to make calls every afternoon and talk to as many folks as I can. I know I've spoken to all of you, and I've talked to all of your labor leaders as much as possible. But I've been making all kinds of calls. I spoke to a gentleman, and he said he walks to the refrigerator more often than he should, and every time he does, the refrigerator looks right at him and says, "What do you want from me now?" So yeah, we all have problems social distancing from our refrigerators and our kitchens. So Glenn, get out to the parks. We have wonderful parks here in Central Ohio. So get out to the parks, get outside. And even my wife, who walks the dog a lot these days, even our dogs, I think, are getting tired of all the walks that they're getting. My dog would like for all of us to go back to work and school so that she can have the house back to herself. But get out, and if you get bored with your own neighborhood, drive to the nearest park. And then there's one more comment. The homeless are still in need. So the community shelter board is going to be on tonight in conjunction with NBC4. So you can call in tonight at 614-821-4444 and make donations that'll be matched 100% by Big Lots. And you can call in until 8 o'clock. I was talking to Lisa Griffin, who's working with them today. They're gonna have J.K. Simmons, actor J.K. Simmons. Eddie George is going to be on tonight with them, and Drew Carey. So they've got a nice event for the community shelter board that's going to be on TV tonight. So here's something, you know, everybody's throwing around the word hero these days. You know, so, you know, our frontline employees, and so folks who understand frontline employees and frontline workers, those are essential employees. Whether you talk about an essential employee as a truck driver, or an essential employee as a nurse or a doctor, a police officer, deputy sheriff, a firefighter, a construction worker, a grocery store clerk. You know, those are all examples of essential workers, frontline employees that are doing all they can to keep us safe, to keep us where we need to be, to keep us fed, to keep us you know, healthy, to keep us you know, to keep us sane, and to keep us where we are. So you know, talk to us guys about those folks and the word hero. You know, hero gets thrown around a lot, but I'll tell you what, in the midst of a pandemic, Mark, you and I talked about grocery store employees. I was talking to you, and I was talking to Joe Mazzola about our firefighters and police officers, and you and I, you know, decided we needed to include grocery store employees in that list, because, you know, the last place I want to be right now is in a grocery store, let alone spending an entire shift day after day after day. My daughter has a girlfriend who's working, you know, 40 hours a week in a grocery store. She graduated from college last spring, and she's working in a grocery store 40 hours a week. You know, we feel for her every day. You know, it's tough. It's tough life right now.
Well, John, I think what you're hearing, the word hero, is something we in the labor movement have known all along, that the working men and women of this country, the backbone of our economy, have always been the heroes. You know, and this pandemic has showed us that, whether it's the grocery store worker, whether it's the bus driver, you know, the teamster, the meat processor, you know, we've come to see, in order to be able to live and thrive, we rely on essential employees. They've always been heroes.
Steve, Dorsey, I know you got something to say about this. Okay, I'll pick one of you. Dorsey, go.
I was just, it's ironic that you brought this up, because I was thinking about this today driving in. You know, after 9/11, there was so much celebration for all our first responders, our EMTs, our firefighters, and everything. And that kind of washed pretty quickly. And then society went back to, you know, firefighters are overpaid, police officers are overpaid. They don't need the right to negotiate and to bargain. They don't need that. And you saw a lot of these states become right to work states, many neighboring states here like Wisconsin and Indiana and Kentucky. And what a lot of people don't realize who don't belong to unions, and I'm sure Steve will speak about this next, is that while Steve bargains for his members for good wages and good benefits, the other thing that he's bargaining for is the proper PPE and safety for his members, so that they can go home safely to their families every night. And I hope that what Mark just spoke about, that when we get through this, which we will get through this, that people remember the pharmacists and the food workers and the grocery store workers, and they remember how important that they are to our society, and they're not looked down upon as, well, you know, that's only an $8 an hour job, or that's a $9 an hour job. That's all those people deserve. And I hope that we realize what an important and essential part of not only our economy, but our community, that a lot of those people are.
Steve.
Yeah, I mean, I think both Mark and Dorsey just hit the nail on the head. You know, really, I think from our perspective, a hero is anybody who commits himself or herself to something that is bigger than them. And we're seeing that across the community day after day, right? We're seeing that in the 19-year-old who's working at Kroger, stocking shelves every single day. And we're seeing all these different facets of the community step up And really, I know, selfishly with Columbus Firefighters, when very early on, and there was a lot of estimates as to, how bad this was going to be or what was going to happen and was our response going to make it. I had no doubt in my mind that Columbus Firefighters were going to step up and answer this call, and we're going to come out better and stronger on the other side of this response. They always do, and they have never not stepped up. That being said, I would be lying to you if I told you we have been completely overwhelmed by all the support from the community at large and the number of people who have stepped up in big ways and small ways to just help us accomplish our mission and work together with us to take care of the most vulnerable in our city and in our county. And it's really been a humbling experience to see so many people come out of the woodwork that otherwise wouldn't have to. And with that, I really do think, Mark hit the nail on the head with a lot of these other roles in, our public health workers, our nurses. They're doing work that is just now getting the attention that it should have gotten for decades. And they're exposing the risk they're exposing themselves to is nothing new. It's just more understood. And, I think it speaks volumes of everyone's character in the labor movement. I think one of the most unfair criticisms that gets, leveraged against organized labor is this notion of being, unflexible or not agile. And I would argue you've just seen one of the most agile responses to one of the most complex challenges in our lifetime, and it's being led by organized labor. And you're seeing it in the results, you're seeing it in the community, and you're seeing it in the work output that's being done by union members across this city and county. And I think it just speaks volumes of the community as a whole, and really the support that's there for organized labor in Franklin County specifically.
So I don't think there's any question, Steve. You make a great point that folks are recognizing the value once again of organized labor. You mentioned some of the folks that they are recognizing the value of. But I'll tell you what, there's one occupation that people are having great affinity for right now and recognizing without question, and that's teachers. Because there are a whole lot of parents right now that are recognizing the value of their kid's teacher every single day. So we only have about 10 minutes left, and we have a lot of stuff to get to. A viewer just mentioned the fact that the Governor DeWine extended the stay-at-home order today. They wanted to know how long. Those are 15-day increments at the moment that he extended the stay-at-home order by. So we'll see how, we'll see in another 13, 14 days, whether they'll extend it by another 15 days or not. This was something we had a conference call. Metropolitan counties had a conference call with the governor the other day. And one of the major issues on it was the communication around the reopening of the economy here in Ohio, and how it's been a difficult communication, difficult messaging around that. And one of the issues was about, we're going to reopen the economy, but at the same time, we've got this stay-at-home order that ends on May 1st. And so, people don't understand, well, are we going to open the economy? And does that mean, my kids can go to play at their friend's house? And, so I think this extension of the stay-at-home order for 15 days helps to address that to some degree. And so the metropolitan counties, who represent 40% of the state's population, about 5 million of the 11 million people, our communication teams are going to work with his communication team to try to smooth and iron some of this out. So we're going to see how that goes here over the coming days and weeks. We're hoping that helps quite a bit. So we got to get to a couple of quick issues here. That'll be probably going to be the last question from Facebook Live. We'll see. They usually come flowing in real fast here at the end, but I want to get to a couple of quick things before we're done. There's been a lot of discussion nationally about hazard pay for essential workers. Understand, we at the county have employees that are bringing up the issue of hazard pay. Understandable, no question about it. You know, while we have a lot of folks out there's no way to be able to tell the carriers from the non-symptomatic folks at the moment. Sherrod Brown proposed a bill in the U.S. Senate for calling for hazard pay in a nonpartisan nonpartisan think tank. The Brookings Institute is agreeing with Senator Brown on this issue. Do your members talk about this much? What are they saying? What do you guys think about this? And believe me, I'm bringing this up, and I haven't spoken to my two colleagues about it, and I haven't. Administration is probably going, "Oh, this issue up." But I think it's an important issue, and it's something we are going to have to talk about going forward at the county. And I'd like to know what you guys think about it. And anybody,
Hey, John.
Mark's
Oh,
not-
yeah. Thank you thanks, John, for bringing it up. Because yes, it is most certainly talked about on a regular basis. And, you know, we have good employers out there, such as the Kroger Company, which, you know, negotiated a $2 an hour increase for our essential workers while they're working. To CVS, employers are recognizing that. And going forward, we most certainly need to have that conversation. And I don't really, you know, want to refer to it as hazard pay. When you use the word hero, I think it's hero pay. You know, if you're a CODA bus driver and you're on the bus and somebody spits on you and says, I have COVID-19, and you show up for your next shift and continue to do your job, you deserve hero pay.
I think I would agree with Mark about the bus drivers, also the food and commercial workers. I think that they are being exposed to hazards now because of COVID-19 that they weren't previously exposed to. I know some of my members have been talking and asking about hazard pay, and yeah, is COVID-19 out there and are we dealing with it? I think that we are, just like the firefighters and first responders are, but I think our occupations have hazards every day, sometimes worse than others. So I would agree with Mark. I don't know if I would actually call it hazard pay. I think that we just have to, again, back to what I said earlier, remember what we're dealing with right now, continue to fight for our members and continue to work in the communities in which we live and to educate people and let them know that even when COVID-19's gone, you know, the firefighters, first responders, the building tradesmen, you know, we're still dealing with hazards every day because of the occupations that we chose. And our members just want to be paid, you know, a fair industry standard, a fair wage, with a very good benefit package that includes healthcare, which, you know, this has spurred the debate of healthcare again, which I had a conversation with somebody this morning about. You know, the fair contracting that the county uses is great because it utilizes contractors that provide health insurance for their employees. And I think that's a wonderful step. And I think that's great. And I think other entities here in Central Ohio need to do that because healthcare has become pretty important here lately. And I think it's really shined a light on healthcare or the lack thereof. So our members, that's the biggest thing that they talk about. They want to make the industry standard. They want to have a job that has good health insurance for themselves and their family. They want to have a good pension and retirement. So that way they can retire with respect and dignity after their career is over, so they can take care of their families and not be a burden on, you know, their community or the taxpayers as well.
All right, guys, we are quickly coming to the end of our time here. Want to mention that as Samantha did earlier, I want to mention that the county commissioners, myself, Marilyn Brown, Kevin Boyce, along with our staff, have been pushing very, very hard for the federal government to help local government with a lot of these costs that we're incurring. We certainly need it. They have been, they've passed 3.5 versions of the CARES Act. Everybody has gotten something so far, with the exception of local government, local or small businesses. We supported that. State government has gotten something. We have yet to see anything, but local government certainly needs some help. We have, in the first 4 weeks, we had put out $10 million just due to the COVID-19 crisis, $10 million that we wouldn't have expended otherwise. And so we are certainly in a situation where we're going to need some help. Unlike the federal government, county government cannot operate in a deficit. So hopefully here in the future, maybe you guys might be willing to help us with that message to our folks in federal government. Our local delegation has been very helpful. Our 3 Congress members here from Central Ohio have been helpful. Senator Brown has been helpful, and recently Senator Portman has been helpful. We have gotten blocked at this point by the administration and by some of the other Republican members of Congress. But our 2 members of the Senate have been helpful. Senator Brown early on, and then recently Senator Portman. So from Ohio, we have gotten all the help that we've needed. And we've gotten, this is past the United States Congress. Our blocking, and the blocking is coming from the Republicans in the Senate. So, but we're still going to need some help. And then the other, I guess in closing, there's a couple things that I want to bring up because we are about to that time. First, I want to thank Jamie on our screen here for doing our signing for us. She's been doing it for the last 2 or 3 shows, and she's doing a great job. Thank you, Jamie. I appreciate that. And then I want to, gentlemen, and please correct me if I'm wrong, but I want to, this whole show was to focus on and to talk about our essential workers. They're keeping us afloat right now. And they are heroes. And, truck drivers, bus drivers, we've talked about a bunch of them, grocery workers, firefighters, including EMS, the EMS guys, construction workers, pharmacists, nurses, doctors, police officers, sheriff's deputies. Who am I leaving out, gentlemen? Anybody? Go ahead. Let's name them all if we can.
Health department workers.
Health department workers. Well, we appreciate them all. I tell folks all the time, I'm a professional patient. I'm in and out of the doctor's office, in and out of on a regular basis. The folks at my doctor's office, heroes. So the folks that you guys are, anybody watching on Facebook Live, the folks that you're relying on a daily basis, for all the things that you need, thank them. When it's appropriate, tip them. Restaurant workers that you're getting, that you're getting carry out food from, they need a tip. They need a tip in this world today, more than they normally would. Tip them, even if you're getting takeout. So, guys, thank you very much for being on tonight. I appreciate it. I gotta tie up by saying that you can find all this information that we've been talking about tonight at commissioners.franklincountyohio.gov/COVID-19. We're going to continue to host these commissioners conversations, so keep watching for the details. We're going to have 2 of them next week. I'm going to have Chip Spinning from our Franklin County Children's Services. He's our director of Franklin County Children's Services. Going to have him on Tuesday. And then on Thursday next week, I'm going to have our city attorney, Zach Klein. You can go to Twitter, Instagram, and Nextdoor to be able to find some of this information as well. So we're going to continue to try to reach out to all of our residents and let them know what we're doing in Franklin County government. And we're going to be posting a lot of this stuff on YouTube as well. So until next time, I am John O'Grady, Franklin County, President of Franklin County Board of Commissioners, along with Dorsey Hager, the Executive Secretary Treasurer of the Central Ohio Building and Construction Trades Council, Steve Stein, the President of the International Association of Firefighters, Local 67, and Mark Fluharty, the Executive Director of the Central Ohio Labor Council, AFL-CIO, saying thanks for joining us tonight. I hope all of this information was helpful and useful. So remember, we're all in this together. Stay safe and healthy, everybody. Thank you. Take care.